everyone, I'm Dr. Pranjal Jain and we are back with another episode of concising and compiling stuff for you to remember better for your NEET exam. Today we have tests for hearing. Let's see. When I was preparing, I used to study it in this table format. It was very easy to revise and re-revise very quickly in under 2 minutes. So let's fill this table today for you. We'll understand each test and then we'll fill it. Mainly the tests you need to know are Rini and Weber, then a little about ABC, Schwabach, Bing, and the confirmatory tests for conductive deafness as well as sensory neural deafness. Starting off with Rinni's and Weber. In Rinni's, you need to compare the air conduction with the bone conduction. So you string the tuning fork, keep it first on the mastoid and then in front of your ear. If you are hearing it in front of your ear, that means your air conduction is more than bone conduction, because in the air you can hear it longer even after your bone conduction sound went off. But in conductive hearing loss, in conductive deafness, this conduction of air is wrong. So you can only hear what is there through bone conduction. That means bone conduction is more than air conduction. Whereas in Weber's, you place the tuning fork hair on the vertex and you see which ear is it sounding better in. If it is equal in both, normal. In conductive deafness, bone conduction is more than air conduction. So when you place it on the vertex, through bone conduction, it would reach the affected ear first. That means Weber is lateralized towards the affected ear. Whereas in sensory neural, it is lateralized towards the normal ear. So a better way to do it always is, first make your assumptions based on Weber and confirm it with Rinni's. Okay. Coming to ABC and Schwabach. Both ABC and Schwabach, here you compare the hearing of a patient with the examiner. So you place it on the mastoid of the patient and then on the mastoid of the examiner. If the examiner can hear even after the patient has stopped hearing, that means the examiner can hear for a longer time, or in other words, patient hears for a shorter time. This is what is seen in cases of sensory neural deafness. Now, how to differentiate in case of conductive deafness? See, the basic difference between ABC, airborne conduction, and Schwabach is C for cover. So in ABC, the external auditory canal is covered. So it doesn't make a difference in a normal or a conductive deafness patient. But in Schwabach test, if this is the ear of the patient and this is the noise coming, due to conductive deafness, there is no disturbance from outside. So he can actually hear for a longer duration as compared to the examiner. Okay, we'll write this down in the table. Just understand the gist of the tests once. Last, as you can see in the picture, is the Bing's test, right? Here you'll hit the tuning fork and keep on mastoid with alternate occlusion of the tragus. You can hear better when your tragus is occluded because there is no noise from outside. But in cases of conductive hearing loss, there is anyways no noise traveling from outside, so there is no change in loudness on occlusion or non-occlusion of tragus. So let's fill that table now. Rinni's test. Rinni's positive meaning air conduction more than bone conduction, which is a very normal phenomena seen in normal cases as well as sensory neural deafness. But Rinni's negative means bone conduction more than air conduction. Weber's central in normal cases, it is lateralized to the same side in conductive, whereas in contralateral side in sensory neural. ABC and Schwabach, we see them together. It is same for the patient and the examiner, considering both are normal. It is shorter in patients with sensory neural deafness. In patients with conductive deafness, we see only Schwabach and it is longer here. Why? Because ABC is C for covered. So conductive deafness patient cannot be differentiated from a normal patient here. Bing's test, we have better on occlusion in SNHL because there is no disturbance from outside. But in case of conductive deafness, it is same because anyways the patient cannot hear from the outside. Let's see the confirmatory tests now. For conductive deafness, we have the impedance audiometry or the tympanogram, जिसका ग्राफ कुछ ऐसा दिखता है. Now we need to know the types and examples of each graph. Normal is A type graph. AD is D for discontinuity. And a S type is S for sclerosis. So a shorter graph if the bones are sclerosed and cannot move, and a tall graph if the bones are discontinued and are moving freely. We see a flat type of graph in case of any fluid in the ear, like in cases of eustachian tube blockage, and C-type graph. C itself looks like a retracted tympanic membrane. The confirmatory for sensory neural deafness are two tests. The first being a recruitment test, and this being the world famous BIRA. Recruitment test means that more and more hair cells are recruited to hear a sound as your decibels increase. A very nice graph I found was a good ear, what it hears at 100 decibels is what a bad ear would hear even at 60 decibels because of recruitment. So many hair cells are recruited that there is a sudden rise in what they hear. Then Bera. Bera mein you need to know the waveforms and that's about it. So the famous mnemonic we all know is E Colaima. Okay, so eighth nerve, cochlear nucleus, superior olivary complex, lateral lemniscus, inferior colliculus, medial geniculate body, and auditory cortex. So confirmatory tests for conductive as well as sensory neural hearing loss are also done. At last, this is what our completed table looks like. Take a screenshot, add it to your notes, and you'll be easily able to revise hearing tests in under 5 minutes, I guarantee. If you like this video, please leave a comment and don't forget to subscribe. Thank you so much. See you soon.